Good morning, everybody. Here we are. We're still in Paris, and we've got a little deviation from our normal episodes today, and well deserved and justly recognised. At yesterday's event, there was a presentation given, and it touched the hearts of everybody. So we decided to get two ladies on board, and we're starting with the first one, which is Dr Radhika Batra. So, Dr. Batra, can I call you Radhika?
Yeah, hi.
Radhika,
sure.
Thank you very much.
Yeah.
Now, Radhika is the founder and president of an excellently named project, non-for-profit, which is Every Infant Matters. And she's a specialist in paediatrics and has been for the last 3 years. So, Radhika, welcome. It's a great pleasure, and I've heard great things after the presentation, so thank you very much.
Thank you
for
so
giving
much
us your
for
time.
having me here.
It's a pleasure. So firstly, what I'd like to ask you, with obviously with all that specialisation and everything that you've gone through with your studies, what made you decide to start Every Infant Matters?
Yeah, so I started with pediatrics 3 years ago, like I told you. And when I joined the field, every day we had duties and we had a lot of extra hours. And every day kids were dying. And initially it was very overwhelming to see a child die.
Oh my God,
but what was even more overwhelming was that most of these children were dying for reasons that we could have easily prevented. You know, be it an infectious disease, which could have been prevented by a vaccine. And what was even worse, that if they were not dying, they were living a life of agony and misery. They were getting disabled, or they were becoming blind due to preventable causes, like because of vitamin A deficiency. So this hit a chord with me somewhere, and I just realized that if something could be done to save these children and something could be done to make their lives better, then why not do it? Because this way, we are just losing so many children to preventable causes, and we just need a simple, timely, cost-effective intervention to actually make a change. So why not provide it to them? So that was the thought behind Every Infant Matters, and we've been around for almost 2 years now. And we've started with some projects. We have a few more in the pipeline. So let's see where we can take it, yeah.
Very good. Do apologise. That's the old telephone going. Salem's going to do the duties there. Right, so that's fantastic. Now, obviously, one thing to have a thought that you want to do something and then to actually make it happen.
Yeah.
So who did you need to help you put all this into place?
So I needed many people, and initially I just started off by helping the patients in my hospital. That was the first step. So we took baby steps towards it, and the first thing I did was I tried to help the patients in my hospital by starting to counsel the mothers. Because what happens in government hospitals and high volume, where the volume of patients is so high that we don't have the time to counsel the mothers. We just spend 2 minutes per patient because the sheer numbers are so much.
Yeah.
So the first thing I decided was to try to give them those extra few minutes and explain a few things which actually could make a difference in their child's life. For instance, the importance of breastfeeding. Like, a lot of mothers don't breastfeed their child. You know, they are taught to believe that it's not good, or it's detrimental, or it's just not needed. It's useless to breastfeed your child. So that was one of the first things I started was counseling. So breastfeeding was one, importance of immunization was the other, importance of hand washing, hygiene, importance of not following the detrimental religious practices that they are taught by their ancestors. You know, there are mothers who believe that putting cow dung on the umbilical stump will help their child. There are some who believe that getting them burnt by iron rods will ward off the evil spirit. And these are some things which are actually, you know, putting them in infections, giving them so much of pain. You know, if you're burning a child's skin, imagine how much pain the child is going to have. So these were the things we saw on a routine daily basis. So this was the first step that I made. I tried to spend a few more minutes with the mothers and give them a little insight about what is good for their child and what is not. And the next step which I did was I roped in my colleagues and I asked them to do the same thing. So that was, of course, a bit of a challenge because not everybody is interested and not everybody has the time. And another challenge was that how do you convince these women who have been taught for decades that this is the right thing to do, and you're suddenly telling them that the exact opposite is the right thing to do. So that was a very big challenge to actually try to convince them. Then you have to tell them patient stories. You have to literally, you have to convince them in a very socio-culturally acceptable way, because you can't really go against all their beliefs outrightly either. So this was the first few steps. Then I roped in my colleagues. Then there was this thing that I saw. There was this blind child who came to the OPD one day.
Yeah.
And it was a very, very traumatic experience to see a blind child, because the child was so frustrated. He kept scratching himself, he kept abusing his mother, actual abusive expletive words. And you could just see the frustration in the child's being. You could see the amount of frustration that the child was going through. So that really hit me. And then when I probed further and understood the cause of the blindness, it was because of vitamin A deficiency. And vitamin A is just 2 drops. It has to be given twice in a lifetime, and then that can prevent a lifetime of misery. So that also hit me somewhere.
And what cost? What cost is that?
Cost, exactly, I'm not sure of, but it's a very minimal cost. It's a very minimal cost, and the government is giving the vitamin A for free in my country. Okay. And in many other countries as well. It's a part of the universal immunization program. So why these mothers were not getting it done and why it was not being given was a question which came to my mind. And then when I Googled the stats, I got to know that 1.4 million children are becoming blind every year in the world because of vitamin A deficiency. So I made that one of my primary focuses in the early stages of the project.
And do you feel that authorities and government and educational bodies should be helping you with this awareness?
Of course they should be, but the fact remains that they're not. They are not. And even though they have their own programs in place, they have ground staff to help in delivery, still, there's so many lacunae in the system that all these problems are happening. Children are dying, they are becoming blind. So there's not much I could do as an individual to actually reach to that, to those high authorities. So I started off on my own, and I roped in a lot of these, my colleagues at first. And then I found out about this one American organization called Vitamin Angels, which supplies vitamin A and albendazole to many countries, but they did not have the kind of outreach and the kind of network that I had at the moment. Yep. So I contacted them and I asked them to send me their vitamins, and I could help them with their dispensing of it. So that's how we started with the Vitamin A project. And we started with 2 cities initially, and we took it over 18 cities in India over the next 1.5 years. So I think over the last 2 years, we've successfully given vitamin A to around 10,000 children, if
Fantastic.
not more. Yeah, so we prevented them from going blind. Yeah, so
that's incredible.
Yeah,
that's incredible. But don't you feel frustrated that just with a little bit of authority help and support, that could be 10 times?
It could be, but then it's just something which we know we're not going to get, so it's okay. Yeah, we've sort of made our peace around it and we work around it. Yeah. So that's it. You're just focused now, irrespective of getting help. Is there any other way that you feel that help could be provided? To these people? Yeah, no. To make people in higher levels more aware and more proactive and want to get involved. Of course, to reach them is a very big challenge. There are many hurdles involved. You have to take appointments. You have to go through their secretaries and those channels, and you have to approach them to the right channels. So that itself is a very big hurdle, at least in my country. So maybe, if someone could connect me to them or someone could make an introduction, that would work in our favor. My goodness, that's the least that we should do, isn't it? Yeah, but so we worked a system around it. So let's see. So these children, they don't have good food to eat. They have never seen milk or cheese or eggs. They live on meager scraps of food, and very, very unhealthy. Very, very, and the nutritional value of the food that they eat is very low, very poor. So they're not getting the essential vitamins from their food. And that contributes to the deficiency. They get worm infestations with the unhygienic practices and the way the food is prepared. And that worsens their nutritional status. So another thing we're doing is we're giving them deworming tablets along with the vitamin A to make sure that it's absorbed properly. And, their nutritional status is not worsened just because of worm infestation. But focusing a lot on the influencing factors around the children for awareness. So the parents, relatives. So I think parents and relatives parents are still easier to talk to. When it comes to the elders of the family, it comes to the grandmothers who have been following a certain practice since the last, say, 3 decades. How do you change their thinking? That is a bigger challenge there. if the grandmother of the child has been telling the parents that, vaccination is bad, it's going to cause harmful side effects to your child, then obviously they're going to believe the grandmother, and they're not going to believe a doctor who they've just met once and who may or may not be having the right intentions for them. So, yeah.
Incredible challenges, huh?
Yeah.
And then there's people here talking about some of the things in cargo and air, and it pales into insignificance. But the ironic thing is there's a lot of synergies, because so many things are going wrong because people don't have the awareness, and it's because somebody else told them that's the way to do things.
Yeah.
So obviously it's a much more a bigger impact at the end of the day, but it's the same. So I mean, what is it? Is it just that people don't have the time, or they don't have the inclination?
It's just a lot of ignorance. A lot of bad practices which have been existing in the society, a lot of challenges in the sense that, the government programs exist, but the awareness about the government programs is not there. Then secondly, if I'm a daily wager and I have to take my child to, say, a far-off city to get a health intervention done, and I'm going to lose my day's salary, I have like 6 more kids to feed, I'm not even sure whether that health intervention will help my child or not. So it's a very logical answer, I'm not going to do it. I'm not going to leave my day's salary to take my child to, say, a village which is far off to get an injection which I'm not even sure is going to help him. So it just comes down to all these factors. It's like a vicious cycle, It just comes down to all these things.
So what do you feel that you need to improve things now moving forward? What sort of solutions, or especially with logistics, you're talking about distances to get, immunisation. I mean, what about certain transportation, even drones?
Yeah. So I think drones have already been are already being used in several parts of Africa, and they are being used to supply life-saving equipment, medicines, vaccines. I just read that in Rwanda they are being used to supply blood components for transfusion in life-threatening emergencies to far-off, hard-to-reach areas. But I think, the true potential of drones is still untapped, and they can be used in many more geographies, in many more areas. Like in India, I don't think the true potential of drones has been explored as of now. So if we could, explore, if some aviation company could explore that and make the use of drones and actually get supplies to the tribal areas, to the islands, to the remote areas up in the Himalayas. So that could really help, because that will be what exactly we need. That's the ultimate solution, is strengthening those long last miles. That is the ultimate solution.
And what about when it gets there? I mean, do you have enough capability to make people know what to do and how to apply?
So that's where the role of NGOs and government agencies comes into play. Yeah. So suppose suppose my NGO tomorrow reaches to that level where I can provide health workers in all these remote areas who will be given a basic training either through a video or through a person going there and being provided that kind of training, if they can be trained for such things. And obviously there must be some doctor somewhere in the vicinity who could take up the training as well. And then these people could be trained in order to give these health interventions, and we could probably go ahead with those steps.
And how are connections like with Skype or FaceTime or whatever, so that people can actually see what to do?
So I'm not sure how good the internet connectivity would be in such areas, but in the ones that they have internet connectivity, I'm sure it can be explored. You could have training sessions over Skype, or you could have even a doctor sitting far away cannot do much. But if, it was just a thought which came into my head, that if tomorrow, for 1 hour every day, I sit on Skype and I ask someone in the tribal areas to have a Skype call with me for those 1 or 2 hours, and whatever mothers have some certain concerns, they can just show me the baby on the Skype and say, okay, this is my child, he's having fast breathing. So at least the least I can do is I can say, okay, no, he's very sick, just take him to a hospital right away. So this is something which just came to my mind a few days back, that why not do something like just like a triage program, a screening triage program, which could be done on a internet basis or on a video call or on a Skype or FaceTime basis. So why not do it? It's a very basic step, but it could make a difference. If something is better than nothing. Exactly. I can't give the treatment sitting in Delhi, but I can give them the insight. Your child is very sick. You have to take those extra, because often they're not aware. You get a patient in the emergency, he's not smelling nice, he's very sick, having fast breathing, their chest retractions, he's been having loose motion since the last 5 days. And you ask the mother, since when, kab se bachcha bimar hai? Matlab, how long has the child been sick for? She's saying it's been 10 days. So what were you doing since the last 10 days? Because they don't have the insight that a smallest of infection starting off in a small child could actually escalate and lead to mortality. So they don't have those insights. So if those insights could be provided to them, even over a Skype call or even over FaceTime.
And what about things like the most common things that you see, the futile bad endings? And what about creating like short little awareness training modules that are pre-taped, and then you can pump them out
of course
in,
we can,
in community areas whereby lots of people can come and watch them and see what could have been done or should have been done in those instances.
Like these futile things, I would say diarrhea. A child can easily die of diarrhea. And you and I will probably not die of it unless it gets...
I don't know, I've come close, I think, a few times.
Really?
I've had some bad ones.
Really? But you and I will probably not die of it. But a small child, if he gets diarrhea, he can die. I've seen it. It's just pure diarrhea. The child got so dehydrated, just passed away. Nothing you could do. So... Okay, yeah. So we do have a lot of implementing partners working with us. They are in 18 cities in my country, 2 in Nigeria. And they are doctors, and what they have been doing is they have been following our model. So they have been giving the vitamin A, they have been giving the albendazole. We are training them, and we are, asking them to do the counseling as well for us. And another project which we have started recently is giving pregnant women prenatal vitamins.
Yeah.
Because if the mother does not get those vitamins, if the mother's health status is not good, which is often the case, because they have to work all through their pregnancy, they're not given nutritional foods, they're not given supplements. So their health is very frail, they're very weak. And then the child they produce consequently is also a low birth weight child, or it delivers prematurely. If a child is born like that, there's a lifetime of consequences to be faced. Because if they are first of all, they are so poor, how will they afford the nursery and the ventilator care? That's the first question. So the child may not even make it. If the child does make it, there may be a brain hemorrhage, there may be long-term complications. A low birth weight child is prone to diabetes in the future. A lot of things, They are more prone to jaundice, neonatal jaundice. And neonatal jaundice, if left untreated, it can cross the blood-brain barrier. It can lead to a lifetime of paralysis. And it's just horrible. So we just tried to, catch the, how should I say it, just to fix the problem before it started. So we started giving them prenatal vitamins. And I think this was a new project. So we've done around 4,000 women till now.
It's fantastic what you're doing. Like I said, again, not that there's the same sort of severity, but even in our industry now, people don't want to be in classrooms. They haven't got the time. They're always on these damn phones. And I know it's different, but if you're not used to getting that sort of information or in a certain way, you're just ignorant to certain things. So we're also now looking at providing short, real, effective bursts of information, but competency-based. And like I said, I think one of the ways now is for yourselves is if people can help, set up these satellite community areas where people can be brought, even if it's once every 2 weeks or whatever. So you have a multiple group of people all together, community. I think that's
a good idea.
But it's fantastic what you're doing.
Thank you.
And normally on these podcasts we come up with an idea for a book.
Yeah.
So I know people might have heard there's somebody else in the background. We're both not looking at the moment, but it's your mum. So the book title I've got is 2 Generations of Ladies That Care, Mum and Daughter.
So much.
Mum and Daughter. I think it's fantastic what you're doing.
Thank you.
And now, is there any way that anybody who's listening could help or support what you're doing? Is there anything that you'd like to say or any contact?
So I think whoever is listening can just Google Every Infant Matters for once. They can see our website. And if they're interested in what we do, they can contact me and then we can take it up from there. Help is always needed. Anyone interested can help in whatever way they like. And if you really want to help, there's always a way. So I'm pretty sure I can help them figure out that way. And I could always use their ideas in how we can make the world a better place. And I could always figure out a system where we could join hands and work towards bettering the lives of these disadvantaged children.
Exactly. And help.
help.
I always play around with acronyms. So I've just how everyone loves people. And one of the best ways is by doing something, especially for people that can then have such an effect on the future of this world, which is the children. So I wish you the greatest of success.
Thank you.
And it's been a pleasure talking to you. I've learned so much.
Okay.
And you went down big time yesterday, so well done.
Thank you so much.
Listeners, friends and colleagues, here we are again, still in Paris, and we've got part 2 of a 2-for-1 exercise with mother and daughter, and we've now got Dr Shelly Batra, who's in obstetrics and gynaecology. Obstetrics, for anybody like myself, is probably better known as midwifery, and she's now specialises in supporting people with tuberculosis, and she's been operating a non-for-profit organisation since 2005. So again, thank you. Just like your daughter, your daughter spoke earlier about vitamin angels. I think the two of you are care angels. So it's fantastic that you care so much about these youngsters. So it's fantastic. It's really great to have you on board. Now, again, same question. What made you decide to do so much for so many?
Well, I started my career as an obstetrician and gynecologist. I made a pot of money. I studied in King George's Medical College, named after King George V of England, in the city of Lucknow. And then after I specialized, I enjoyed surgery a lot. I enjoyed operating. And at that time, I started doing free surgeries for the poor. And for 10 years, I used to go to the slum areas, find out people who've got menorrhagia, fibroids, who needed help. For example, there was a lady with polio. She couldn't push the baby out. Oof. She needed a cesarean section. So, and then there were patients who were in line waiting in public hospitals, waiting for their turn. So if a woman has got fibroids and she's bleeding and she's told your hemoglobin is 7, come back when it's 11. But because of bleeding, it's going to become worse. So these are the people where I would intervene and operate for free. But at the same time, one needed money for medicines, for the hospital bed, for the suture material. And I did a little bit of fundraising at the same time. And I kept it up for 10 years. And after 10 years, I realized I've helped a lot of people, but there is no impact in the public health problems of my country or the world. And then I did more research, had a lot of discussion with health officials, my own colleagues from medical school, and I realized that the biggest health problem in the world is tuberculosis, or TB as it's commonly known.
Yep.
Surprisingly, TB is a disease that belongs to the days of the pharaohs. It's more than 5,000 years old, and it's fully curable, and medicines are available for free from every government.
But it's only been curable since the 60s?
Yes, since the 60s. But the sorry state of affairs, the shame of it is that there are 10 million new cases every year in the world. Yeah. And 1/4 will die. And 1 million children are suffering every year because of TB. Now, why is there this big gap? Why do we have these issues? There has to be a problem there. When the entire world is focused on TB, there are governments, there are international agencies, there's the World Bank, World Economic Forum, WHO, you name it. There are the governments, there the French aid agency, DFID, the UK aid agency, USAID, so many people focused, but nothing is happening. So there has to be some problem somewhere. So the first thing I did was to find out what are the gaps that need to be fulfilled. Yeah. And I found that the biggest gap was that the last mile connectivity is missing in the government programs. So the country, like for example, India is divided into zones. Each zone has got a TB hospital. There are free medicines, free TB test, free X-ray, free sputum test. Patient has got hemoptysis, coughing up blood, patient can be admitted, operated, everything is there for free. But there is no link between well-intended government programs on one hand and people who live in poverty. And these people can be geographically disconnected, living in way out areas like on mountains, in villages, far-off areas, or they could be next to the government hospital. A slum next to the government hospital, and the patients live in isolation because of fear, because they're intimidated, or because they don't want to step into a TB hospital.
Plus the stigma that it brings.
Stigma that it brings. Now, if I'm coughing up blood and there is a hospital next door that says TB hospital, I'll be scared to enter because someone might see me.
Also, you're worried that you've got TB.
Yes, I might be suspecting I've got TB. The signature sign is coughing up blood. Yeah. But I don't want to go for treatment because someone will see me entering a TB hospital. Yeah. And then my husband will know, the neighbors will know, The whole world will know, and what will happen to me?
Yeah.
There is so much stigma against TB. Patients are suffering terribly. 100,000 women are thrown out of their homes every year. This is India alone.
My God.
To die of disease and starvation if they've got TB.
I had TB as a child, and I caught it from, I had bovine TB.
Yes, because of drinking milk from
milk
a cow that has not been
from the
born.
cow on the farms in Ireland, yeah. And you're talking about stigma. That was in the early 60s, so it was just as it was able to be cured. But what happened was, because I had it, my parents were told to write a list of everybody that I was in contact with on a regular basis. And as a result, our family, my parents, they lost some friends because their children themselves, they all had to go for tests and everything. And as a result of the tests, I know one case where one of the daughter was found to have multiple holes in the heart from the tests. So, of course, she was taken straight in, operated on, very, very critical condition, whereas the week earlier, she was fine. And the parents then could see their daughter almost, they didn't know what was going to happen. So I can see where the stigma comes from, because they're thinking, well, if you hadn't have done this and if this hadn't have happened, our daughter wouldn't have known. But she got cured, and it was fantastic. But that stigma is still terrible. Even I can remember teachers saying you can't swim, you can't run, you can't do exercise, don't go in the sun. And it was just sheer, I don't know what it was, but one teacher just said to me, come on now, you need exercise. And I was determined to do something different. But I never told my mother or anybody. And so TB to me is, and the treatment as well, you know.
Yeah,
everything
tedious.
up your nose down and being pumped out, and awful. So,
and you see, another thing about stigma is that people lose jobs.
Yeah.
They lose their livelihood. Because if someone has got TB and he's working, then no one wants them because they'll spread the disease. It's infectious.
Exactly.
And you know, there are factories where they are, say, in a room like this, 20 feet by 20 feet, there'll be 50 people sitting next to each other.
Yep, very close proximity.
Very
but what
close
about,
proximity.
like you said about the spittle, because people do clear their throats an awful lot, which is, that's also an awareness thing that surely people should stop doing that.
Yes, so part of our program is a lot of TB awareness and education wherever we go.
Yeah.
And we do this awareness by going door to door. We go to socio-economic centers like the Buddhist pagodas in Cambodia, the temples, the mosques. All these places we go in, we talk about the symptoms of TB. And the health workers say, oh, are you losing weight? Are you coughing? Are you coughing up blood? We can help you. We don't use the word TB.
Yeah.
We just say it could be an infectious disease and we'll be happy to help you. And it's fully curable. And that usually works very well.
So you know and they know.
Yeah.
But it's just the fact it's not been said. Now, listen, I've got to ask you a question, and especially now seeing the two generations of, like I said, care angels. But, I mean, what motivates you and makes you drive to do so much for so many with so little real support?
Well, there are two things here. We have one. I feel I have one life to lead. And I'm 60 now. I don't know how long I have to live. And I want to make the most of my life. And I think the world has got rid of smallpox and the plague. And, well, polio, we are almost done with polio as well, barring a few countries.
Yeah.
And why can't we get rid of a curable disease like TB? Let's do it in our lifetimes.
Yeah.
And that is what motivates me. And there are very few people who actually do the real work. There are a lot of people who do awareness activities or they'll make a film on TB. I mean, of course, all that is important. But the most important thing is reaching out to the people and connecting with the people themselves. Meet them, treat them, give every dose under supervision. Let no one get drug resistance. And every dose has to be given under supervision for 6 months or 8 months or 9 months. And for that, we use local people, hire and train local people, give them a technology application, e-compliance, which is a simple fingerprinting or iris printing device. And whatever is culturally appropriate, we use that. So every dose is monitored in real time.
So again, what we're talking to with Radhika about how to maximise the awareness and let people know, that's the sort of technology that you need, the support that you need, plus the last mile.
Yes. So we've been supported extensively for our technology by donors such as Qualcomm. Yeah. And in fact, our technology, e-compliance, was created by Microsoft Research. And Bill Gates tweeted about it also. And then later on, we were funded by other donors to develop these training platforms So what we do is we have this WizIQ platform,
Yep.
and we've got these e-counselling videos. And with the help of this platform, there's a patient living in one small hamlet far away from the road, 7 miles away from the nearest road in the Himalayas. And if the patient is very reluctant to take the medicine, we can counsel them sitting in the Delhi office and talk about TB.
Yep. Yep.
So everything, technology is a great enabler when it comes to the public health issues of the world.
Yeah, no, it's incredible. And again, we were talking about drones and things
Yes.
like that. It's immense what could be done.
Yes, and drones could be very useful for TB patients because
Yeah.
you see, the sputum sample has to be taken to the government lab.
Yep.
So if we could have drones to pick up the sputum sample from far off areas,
Yep.
take it to the laboratories and then transport the medicines in the same way, that could be a very good solution.
Yeah. No, it's amazing, isn't it? Amazing. And rest of your family, how many are in the family?
So I have my husband, I have 2 daughters. My husband is an endocrinologist. He's a specialist in diabetes, thyroid. He's working in Apollo Hospital. And then, like I always tell him, you provide the bread and butter and the cake, and I'll provide the good karma for the family. And I have 2 daughters. My elder one is a computer specialist. She spent 8 years in the US. She got 2 degrees in computer science. And she was getting any kind of plum job in Silicon Valley. And she chucked it all up to come back and join my NGO as Director of Technology because I needed someone.
My goodness me.
And on a very small salary, I can just pay her peanuts. But then she's doing the work that she always wanted to do.
And there's a lot to be, I mean, everybody needs money, but there's an awful lot to be said when you look back on your own life's book.
Yes.
And you're happy with every chapter,
Yes.
and you've done something special.
Yes, and I'm more than happy with my Radhika, who's doing so much at such a young age.
Yeah, my goodness, what a family, eh? Hey, if ever there was a disaster, you guys would be included in the boat, huh?
Oh, that's so sweet.
No, it's fantastic.
Nice
My
of you to
goodness me.
say so.
And so what's next? What's next now for the family?
Well, for the family now, next thing is we want to take our programs forward.
Yeah.
Radhika's work is in India and Nigeria. She's exploring partnerships. Her work is basically through partnerships. First partnership is Vitamin Angels, giving free meds. Second are the implementing partners in India and Nigeria. And now she's exploring partnerships in other countries with local NGOs like church groups, local hospitals serving poor people. And my work is there in India, Cambodia, Afghanistan, Zambia. And we want to go to other countries. We want to scale our programs. We want to replicate our model. We want to be a resource center, give our technology and our model to other NGOs and other governments, whosoever wants. And here I want to thank the UK government because we were funded by DFID for our work in Afghanistan for 2 years, and we exceeded our targets. We broke the gender barrier. And we are lucky we got a second round of funding for a much bigger project from the UK government.
Fantastic. Good old Boris, eh? Oh, brilliant. No, and you deserve it. You deserve it.
Thank you very much.
Listen, thank you so much for coming on and sharing it. And you're both inspirational. And to have 2 ladies of such talent, commitment and passion in the same family must be incredible. So your husband and your dad must be so proud of the whole family. So well done for what you're doing. And please God, you'll get some more help from areas and places you didn't expect. So thank you so much for coming on.
Thanks very much for having invited us.
It's an absolute pleasure. Thank you.